Namaste, myself Dr. Saurav KT, Shalyendra PG scholar from Government Ayurveda College, Trivandrum, Kerala. And I'm here to explain on a novel sliding Ksharasutra technique which can enhance the efficiency of Ksharasutra therapy. At the same time, it can reduce the pain experienced by the patient and thereby increasing the patient comfort. Quite often in patients, we see that within 2 or 3 days, with good cutting rate, it would have cut through. The Ksharasutra would have cut through the tissue and it would be lying loose in the tract. So, in midweek, if we have to keep the intended tightness, dridam, so we might have to untie the Ksharasutra and retie it, which would cause discomfort to the patient, or we would have to change the thread with a new thread, which would cause wastage of the Ksharasutra. So we developed a methodology to overcome all these hurdles by replacing the square knot with the sliding knot. Now we will explain the sliding Ksharasutra technique with this thread. So after placing it into the fistula tract, so we'll have a right limb which I have stained it as a blue color, and we'll have a left limb. Okay, so we have to place the right limb over the left limb. Okay, you have to place it over the left limb and we can pinch it together. You have to hold this at this place for the whole time. So now using a artery or a mosquito forceps, you can hold the tip of the right limb and take it through the loop. Okay, it is taken through the loop and take it over and under the right limb, over and under the left limb. So this leaves you a triangle over here and a loop over here. So through this loop, you have to take the Ksharasutra. So the tip is taken through this loop, which will give you the sliding knot. Okay, here you can see this gives you the sliding knot and it will slide on this left limb. You can see we can slide this forward or you can slide this backward as required. Okay, so you can keep it tight as much required, and normally in the laparoscopic surgeries these two will be tied together and it will lock it into position. But what we need in the Ksharasutra is only to prevent this from sliding backwards. So for that purpose, we'll put a small simple half hitch knot on the single left limb. So usually we would put a knot like this or in the anti-clockwise way like this, but here if we put it like that and hold the tip, we won't have a knot. See, there is no knot at all. So instead of taking the forceps towards you, you take it away from you. So in an underhand way, that will provide you a half hitch on the limb you were holding. So now through the loop of the knot, you hold where you want to place the knot and just pull it further, which will tighten it over there. So now by placing this over here, it will prevent it from sliding backward. But after a few days when the thread have cut through, you can slide this further forward, and the knot was here, the original stay knot was here, but after sliding it forward, you can place a new stay knot at the new position just like before and lock it into position over there. Okay, so this can be done as many times as required. Now during thread change, a new thread will be tied onto the old Ksharasutra, and all these stay knots, multiple stay knots, which can become a bulky knot, need not pass through the fistula tract, which would cause discomfort, because since it's on a limb that slides, at the time of Ksharasutra change, you can simply remove this by cutting. We'll cut this and then usually we'll pull like this, but instead here we can actually remove these stay knots simply by pulling on it, which would ease the discomfort of the patient. So now only a small loop has to pass through the the fistula tract. Okay. By adopting this novel methodology, we can achieve a significant increase in the cutting rate, at the same time provide patient comfort. Thank you.